Hi, my name is Kristen Robinson, and today I would like to talk with you about my Healthy 2020 objectives. Type 2 diabetes is a disease that results from defects in insulin secretion by the pancreas and utilization of insulin in target areas. When the body's tissues' normal response is impaired, it leads to the development of insulin resistance. Thus, type 2 diabetes is formed by the body not making enough insulin or becoming resistant to insulin. There are currently close to 26 million people that have type 2 diabetes and another 79 million that have prediabetes, with these numbers expected to grow twofold by the year 2030. In 2007, there was over $174 billion that was spent on diabetes, which equates to over 18% of medical costs in the United States. This is due to the fact that medical costs for individuals with diabetes are 2.4 times as much than individuals that do not have diabetes. There are risk factors that individuals need to be aware that some genetics play a role in the development of type 2 diabetes, but other times it is usually due to lifestyle choices. Genetics can play a large role in the development of diabetes in a person. A study by Edwina Yoon, James Pankow, Brad Astor, Neil Powell, Christopher Soder, and W.H. Linda Koa in 2007 concluded that there was the highest risk for developing diabetes when a person has a family history of having coronary heart disease along with a prenatal history of diabetes. In another study by Hyun Lee, Isoma, Kaskinen, Groot, and Tsuomi in 2000 discovered that a family history of diabetes has an effect on the onset of type 2 diabetes, but the type of diabetes also plays a role. If there's a history of type 2 diabetes in a family, it showed an increase in the age of onset of type 2 diabetes. If there's a small number of type 2 diabetes in family history, the results showed a delay in the onset of type 2 diabetes. It's also important to point out that they also saw when type 1 diabetes was introduced into a family, it showed an increase of having type 1 diabetes rather than type 2. Aside from genetics, people can do things that will help lessen their risk of their chances of developing type 2 diabetes. The reason that so many people are unaware of their risk of developing type 2 diabetes is because of a lack of communication from healthcare providers. The communication between healthcare providers is one of those, if not the most important way to help reduce the development of type 2 diabetes. Every day, people are not completely aware of what they are doing that could possibly be a risk to help develop type 2 diabetes, and that's really where healthcare providers come in. It's been observed that if a person is informed by their healthcare provider that they are pre-diabetic, then most try to change their habits. In a 2006 National Health Interview Survey, it was indicated that they were pre-diabetic by their healthcare provider, that 68% tried to lose or control weight, 55% began to exercise more, and 60% reduced their calorie or fat intake, and 42% were engaged in all three. These numbers show how important it is for healthcare providers to communicate with their patients to help them lessen their risk of developing type 2 diabetes. Physical activity also plays a huge role in developing the risk of diabetes, type 2 diabetes, that is. David Nathan, who is a diabetologist at Harvard, has stated that changing one's lifestyle not only can help reduce the risk of the development of diabetes, but it can also have so many other health benefits. Along with physical activity, a change in diet can help reduce the risk of developing type 2 diabetes. Type 2 diabetes is a problem today that is increasing in numbers. If Americans want to slow down their development of diabetes, then they need to be aware of their family history. Family history is not something you can change, but you can be aware of what your family history is to be able to change the way that you live. Also, it's not only the patient's responsibility to know their risk factors, but the responsibility also falls on the healthcare professionals. Healthcare professionals choose their careers to better the health of the general population and they need to communicate with their patients. Healthcare professionals know more about diabetes than the average American, and they need to be able to communicate that to those that they work with. This does not say that healthcare professionals are to blame for the increase in type 2 diabetes, because they cannot make their patients change their lifestyle, which really makes it a two-way street. If patients are made aware of their risk factors, then the ball is in their court to change their life, to reduce their risk of developing this dangerous disease. Thank you so much and have a great day.